You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures with the use of mini dental implants. With us, we have an expert on the topic, Dr. Keller. Dr. Keller, welcome to the program.
Thanks, Randy. Good to be here.
Now, for people that don't know you or know your practice, who's your typical patient? What are the different procedures you do? Because you do more than just the dental implants.
Yeah, sure. Randy, I have a general dentist practice, so I see people from birth to death.
Okay.
We see the kids, they come in, they get sealants done, they get their well baby checkups, and we teach parents how to take care of them. We get teenagers that come in for Invisalign and for getting their wisdom teeth removed, getting their teeth bleached for their senior pictures, that kind of stuff. Parents come in for fillings and crowns. We have people that have periodontal disease that need cleanings or surgery or grafting or things, they come in. We have a large group of patients that are retired that come in and they have crowns put on their teeth, or they have partials or dentures or implants, all that kind of stuff gets taken care of. I have a fairly large population. I do IV sedation. I treat a lot of fearful and anxious patients. We have lots of patients that come in.
So you're certified for IV sedation?
Absolutely, absolutely. And that's a big thing for us.
Was that your military training gave you that?
Yeah, I got that I did it when I was in dental school, and then I did it several times trained in the military. But you know, there's two groups in that case. There's the ones that are really just, they don't like the dentist. They're scared. They think it's going to hurt. We put them to sleep. They go home, no memory.
Are a lot of people afraid of the dentist?
A lot of people.
I know nobody likes going to the dentist.
A lot of people are.
Do you hear that, by the way, all the time?
Every day. My favorite is,
say?
Don't take this the wrong way. I hate the dentist.
What do you say to that?
Don't take this the wrong way. I hate anesthesia. They don't like that.
What do you say? By the way, we should mention, you are a very funny guy.
Oh, good.
We talked about that off camera, and I had to pull myself together just to even start the show. So,
but Randy, I get that a lot. And here's the honest truth.
What do you say to that?
I tell people two things. It is reasonable for someone to come in and say, I don't like the dentist, because they're anticipating I'm going to hurt them somehow.
Okay.
So I let them know that's a rational thing to think. I would be afraid too if someone was coming at me with a needle. But then I tell them that because that is something that they can't overcome internally, I can help them. I can use nitrous, I can use some pills, I can use IV sedation, whatever it takes. I can get them from where they are to more comfortable. And as we develop that trust and that relationship, I have lots of patients, their first 2 or 3 appointments are IV sedation, and their next one, nitrous, and then after that, nothing.
Nitrous is what? That's
the laughing gas.
Okay.
Yeah, exactly. So that's a big part of our population. And we get a lot of people that come in that are professionals. They're like, look, I got 2 hours and I need 3 crowns. You knock me out, get the 3 crowns done. I'm happy as a clam, and all right, let's do it. I do that a lot.
And IV sedation is safe.
Absolutely. It is much, much safer than general anesthesia. I don't have to paralyze you. I don't put a tube in your throat to breathe for you. You're not going to stop breathing. You're not going to feel like, oh no, I'm trapped in my body. I can't tell the doctor.
And you can pull them out of it right away.
Right away.
Is that the big benefit?
That's why it's so safe over pills, yeah. Because I can titrate it, meaning I can make it you as deep into the sleep as I want or as shallow, and I can get you out of it right away.
Okay, good.
Very, very safe.
So what's changed over the years? Because we've talked on the phone. I mean, now in just a few visits, you can give, I guess, some people like a fixed set of teeth, a full arch of teeth.
Right.
In the old days, I guess it took a lot longer.
Sure.
So what's changed with dental implants?
Great question. And a lot of people don't know this, so I'm glad, thank you, that you asked that. You know, the biggest thing that's changed is the philosophy that we use. 60 years ago, we drilled a hole, put a piece of metal in it, and sewed it shut for 9 months to a year, and just waited hoping that it would heal. Okay. And when we did that, we put them right in the front on the bottom of your jaw, and that was the only place in your mouth that we put implants. And the only thing we could do is lock a denture to it. Well, people said, well, that's great, that's working. What else might work?
All right.
So they started putting them in the backs of your mouth. They started putting them in the front. They started putting crowns on it. They started saying, well, if it works at 6 months or 9 months, can we do it in 6 months? Can we do it in 3 months? Can we put a tooth on it right away when we put the implant in?
Is that true, by the way, the same day you go in?
Absolutely.
You get a tooth?
Absolutely, but not everybody can have that result. But is it possible? Today it is, whereas 50 years ago it was not possible. So now you can look under the skin and you can see what kind of bone is there. If it's dense or not dense, you can see what kind of implant might be the most successful. If there's any anatomical things you got to get rid of, you don't have to cut through the skin. We used to have to cut the skin and
the gums. We're talking about the gums.
The gum, yeah.
Because it seems like a very painful procedure, by the way.
And that's a great thing, Randy. Your bone has no nerves. You can cut your bone just like cutting your hair or your fingernails, no pain at all.
Okay.
But if you cut the skin, that's where it hurts. Because of imaging, we don't have to do that anymore. Little topical
anesthetic. Not as much.
Well, depending. For many implants, hardly ever. 1 out of every 50 cases, you cut the skin. Otherwise, you just put a little topical on it, punch a hole through it. That's it. No
Interesting.
pain medicine afterwards, no swelling, no bleeding, none of that stuff that we've traditionally associated with these surgeries. So that's a big change. We've changed the implants. The implants used to be just a titanium bar. Now we've made them with different thread designs and metal that actually grabs the bone and starts to heal right as it's put in, so it's initially stable. Never available. Today that's available. The techniques, like I said, everything used to be cut open to expose the bone.
So that's why the pain is less.
That's why there's no pain, because we're not cutting you open.
Tell me this though, because it's still being done today. I don't know if I told you this, but I had an oncologist on my show. I'm interviewing him, and we're off camera talking, and he's saying he's getting a dental implant. In fact, that's why he postponed. And he says, I'm going to get the tooth on top. And he's a healthy 50-year-old guy.
Right.
He goes, in about 6 or 9 months, I'm going to get the tooth on top. Now, I didn't say anything. Right?
Yeah.
But is that kind of like an old school mentality?
What it is.
He seemed like he was healthy. He's missing one tooth.
Right. What that is the comfort level of the surgeon and the doctor putting the crown on it. Is it old school? Well, there are faster ways to do it today.
Do you think it's old school?
I don't do that for my patients. Because my patients are coming to see me wanting something today. They have been miserable. These are a lot of these are denture wearers. They don't fit well. They're self-conscious. Their teeth click together. They can't chew. They can't smile. They just can't enjoy their life. And they come in and they're like, Dave, I want to get fixed today.
Are there a lot of denture wearers, by the way?
Absolutely.
Like in your town, for example?
Absolutely.
What would you say?
The national statistics are 25% of Americans over 65 are missing all of their teeth. And another 25%
like 50,
are
60 million people.
Yeah, tons. In my area, I'd say 50 to 100,000 people in my area.
Is that right? Upper
have
or lower
dentures.
denture?
At least one, an upper or
but if
lower
it's so
both.
good, why aren't they all doing it?
Great question. The biggest reason is they don't know. They just don't know. They get all their teeth taken out and they retire into never going to see a dentist again.
Okay, that's a good point.
So they're not coming in to see us. They just don't know.
Interesting.
Fear. Some of them, most of them that have lost their teeth, there's some baggage with that. Their teeth were hurting them, or they had bad breath, or they had periodontal disease. All of these things are reasons they lost their teeth. They don't want to go back. I mean, they have nightmares about coming to see us, and they don't understand how simple it is to move forward in the next step. Some of them have been told incorrectly they're too old, or they don't have enough bone.
My mother, I don't know if I told you this, my mother, she was 74, this was 5 years ago, 74, and her medical doctor said, you're too old.
Right.
And I was listening to some of the doctors on my show, and I'm going, no, I don't think you're too old. And she didn't believe me. She wouldn't.
And she's not. I mean, the oldest I've done is 93. I've put implants in 93-year-olds.
Why would a 93-year-old want to do that?
Because they want to have their life back. They want to chew again. They want to smile.
Okay.
They want to be able to enjoy their foods. They don't want to have a granddaughter sit on their lap and ask grandma, why do your teeth flop around like this?
Does that happen? Do they tell you that happens?
Absolutely.
On the consult,
it does. They tell you these stories. They wake up in the morning and they spend 30 minutes looking for the denture that fell out in their mouth and it's stuck somewhere in the sheets.
You've heard that before?
Absolutely. And they get to the point in their life where they decide, you know what? I deserve better than this. I'm not happy.
So they just don't know what's available.
They just don't know.
But as a recap, I mean, so you can give them like a denture wearer watching this.
Yeah.
Give them these mini dental implants.
Yes.
Right?
Absolutely.
To give them something that either snaps in, snaps out, or fixed in their mouth.
Absolutely. Yep. And if it's dentures and they like their dentures and they feel well and they look well, you can come in today, put the implants in, snap it in, walk out, and you're done.
Same day.
Today. Absolutely.
Sounds like a bit of an exaggeration.
It's not. It is not. That's what mini implants were designed to do.
But there has to be at least 2 visits, right? They've got to go once for the imaging.
Only if they come in for a consultation. You're right. They do come in for a consultation.
But once they're identified that you can do this.
And once I've decided that their dentures are quality dentures, some of them, part of the problem is they never got a full set of permanent dentures, and we need to address that. But the ones that come in with great fitting dentures and they like them, absolutely, it's one day. And they're done.
Now, these mini implants that we're talking about, small diameter implants,
yes.
These are not to be confused with traditional implants, but these are about 70% less cost.
Absolutely.
Elaborate on that.
Well, the big thing to understand is the cost of a regular implant is associated with the research and development to make it.
Okay.
The newer technologies will always be less expensive. Look at our cars. Every single year, our cars are less expensive. They have better gas mileage, more creature comfort.
Especially
they look
the
nicer,
hybrids, yeah.
Right? They're all better, and it's because they don't have to pay for R&D. Somebody else did. So conventional implants are more expensive because they're still trying to write off that R&D. Mini implants don't need to do that because someone else did that.
Yeah, but here's the argument, and people need to watch this. It's a real interview.
Yeah.
But they need to realize I'm not trying to side with you here.
I get it. Yeah.
But I've had dentists that say, Randy, there's no science behind these mini implants. I don't trust the mini implants.
Sure.
What is your response? You must hear that. Do you hear that?
I do. I hear that, especially from the specialists. Well, the first thing I do is I, like them, was very skeptical. I'm not an early adopter. I want good, solid science. Okay. The most recent studies that came out are 10-year studies. The 10-year studies compared to 10-year implant studies show that mini implants are 97% successful.
Meaning they don't fall out.
That means in 10 years they're still there, still working.
Okay.
Conventional implants are 95% successful. So they're the same. At 10 years, they work exactly the same.
One was like 95, one was 97%.
Yeah. So in my mind, it's the same. But I can
it's the same, right?
Yeah. And I tell patients, look, at 10 years, they're the same for 70% of the less cost.
So there are published papers, 10-year studies that they work.
And
that's good.
And the other thing is we in America, we have this really weird phenomenon. 20% of general dentists place implants in America. 80 to 90% in every other country in the world of the implants that are placed by general dentists.
Okay.
And so the research outside of the United States is even more compelling because they've been doing minis for longer. We just are starting to adopt that technology in the United States a little slower.
You know, when I got on the phone with you, I didn't tell you this either, but I thought this potentially could be gimmicky.
Oh, absolutely.
And then I think you emailed me the research.
Yeah.
And so they work. I mean, that's the main thing.
They do.
But you say things like it's changing people's lives and things like that.
Yeah.
Give me an example. I mean, when you say it changes somebody's life.
Sure.
I mean, do they tell you
Can I show you a
that?
picture?
Yeah.
Let me show you a picture.
You brought pictures.
Yeah. Okay, so this is Randy. This is my Randy. Okay. Randy's 40 years old, and Randy has two issues. He just got a promotion, and he has felt self-conscious about the way he looks for 10, 20 years. Okay. He's one who's known for a long time he needs to have his teeth out. He has advanced periodontal disease. His teeth are wiggly. His breath smells. Everything's uncomfortable for him, and he just does not like the dentist. Okay. Randy comes in, gets the teeth taken out.
So those teeth had to go, no matter what.
Yeah, they were hopeless. They weren't going to make it. Teeth come out. Dentures come in with implants to stabilize the dentures. Okay. And he goes from the person whose smile looks like this to someone who smiles. A big, broad smile. In fact, Randy is the guy now that's at work, and he laughs, and he's tips his head back with these big, exaggerated laughs, and he's confident that his dentures aren't going to fly out of his mouth.
I mean, you say in his 40s, I mean, that's pretty young to be wearing dentures.
Well, Randy, any age is too young to wear loose-fitting dentures. Any age is too young. But for 40 was definitely too young. And that was his big
whatever you
hang-up.
want. I mean, this guy.
He can. You know, and that's part of why he came. He went right to. He resisted dentures for a long time because he didn't want to not be able to chew and speak with confidence. Now, Randy, look how natural his smile looks. He's a handsome guy, and that shows.
And that's like a denture that's attached.
Two dentures, locked onto implants, and that has changed his life. Now he's 40, 45 years old. And he can smile again, the smile that he's always wanted. I mean, imagine how that feels. Every day of your life, you couldn't smile, and now you can. You can let the inner you come out, and you can be who you want to be. That's what this Randy.
How soon can they eat, by the way?
Right away. They can't eat right away. Now, some people will say, I give them an apple and they chew on it. I don't do that because I'm very conservative. I want to give them every chance.
On YouTube, I see things like that.
Yeah, and can you do that? You can, but I don't see the reason to.
Eat soft food for a week or so, a couple weeks.
And there's two reasons I do that. One is I'm cautious. I want them to succeed. But two is I also want them to enjoy the anticipation of the moment when they jump into that apple or that piece of steak or their broccoli or their corn on the cob, and the taste that comes into their mouth, and it's almost a religious experience for them. They haven't done this for so long, and now they can.
What if you've been in dentures 20 years, 30 years?
Great.
And have been told like not enough bone?
Right. Great question.
Is that too far gone?
No. So mini dental implants, one of their big advantages is their narrower diameter. So they can fit in situations where before either the answer was no, you can't do it, or we have to do it grafting. We have to take a piece of your hip or rib or your chin or something and graft. mini implants get around that. Sinus lifts, which are very common. There's no bone up there. We can angle the mini around that in the remaining healthy bone, and then you have the advantage of not having to do the grafting. None of the pain and the expense with some of these complicated things. I mean, that's why minis are so revolutionary right now, because we're getting around some of the big impediments to patients accepting care.
So no more dentures. And for people just tuning in, we're talking about getting a fixed set of teeth in just 1 or 2 appointments.
Right.
A denture watch this. We're talking about mini dental implants.
Sure.
They go in. If they're candidates, same day they walk out with a full arch of teeth.
Possible.
Either fixed or snap in, snap out.
Possible. Absolutely.
And they can eat right away.
Yeah.
And you say that pain is not something they're really complaining about.
Absolutely. I have had nobody complain about pain. That's
really?
just not it. Yeah. What you have to understand is, again, the pain of dental surgery that we've always had is the old techniques where we had to cut open the gums and pull them off the bone and flatten the bone and graft and things like that. That doesn't happen with mini implants.
So the mini implants just kind of poke through?
Poke right through the skin.
And the bone doesn't have feeling, as you say.
And there's no nerves in your bone. So it's just that little area. And it feels, I tell people, I don't drink coffee, but it feels like a coffee burn or feels like a pizza burn. You have a little sore spot, you touch it with your tongue, it feels a little uncomfortable for a day or so. That's it. No bleeding, no swelling, super comfortable.
And these are about 75, 80% less than traditional dental implants.
Yeah.
Because people don't have 40, 50,000 to put in their
That's
mouth.
exactly right.
Sometimes.
Exactly. And you know what I love? And you know, one of my big thrills with people is they say, you know, Dave, I want to do this, but I can't afford what I really want. What I really want is I want something fixed. All I can afford right now is some minis and a denture. And I say, great. Let's put the minis and the denture in, and you start saving your money, because I can use every one of those little implants on the fixed. And we'll have people that'll save for 2 or 3 years after they get their dentures, and then we can take them away and we can put in the fixed, and then they have what they want. That is hard to do with conventional implants, but it's very simple to do with mini implants.
So do you think, are you of this feeling that, let's say there's at least 1,000 people within 5, 10 minutes, or let's say a half an hour of your practice that have an upper lower denture, that if they knew how easy it was and how affordable it is, I'm just curious if this is how you feel, that they would be lined up to do this?
Absolutely. Absolutely.
You believe that, really?
I do. But there's some...
I think you said that on the phone to me.
Yeah, there are some impediments. One of the big things, this is really funny, a lot of people that wear dentures accommodate to it. They've been wearing it for 20 years. Are you happy? I'm fine. But do you want to be happy? Because fine isn't happy. It's settling.
Okay.
Do you really want to be happy? And as they begin to think about that, and they begin to think about, why am I not happy? Why do I not cover my mouth when I eat or when I try to smile? Why am I embarrassed to meet new people? Because I'm afraid that my dentures will click together and they'll know that they're dentures.
Is that right?
People, they feel this way. My message to them is, that doesn't have to be that way. If you'll just come in and let me explain what the options are. So many people are amazed.
And dental insurance does not cover this.
No, this is
in
not
the U.S.
Right.
Or Medicare doesn't cover this, but you can make it affordable.
And that's why I do. Yeah, one of my other degrees is a business degree. And the reason that I did that is I figured out how to use good business principles to lower the cost to increase the value to patients. I want them to have this because it will change their life. Look, imagine this. If all you can do is eat high carbohydrate, sugary, mushable foods, what's that going to do to your diabetes? What's that going to do to your blood sugar, to your body weight? You're going to balloon up. You're going to be lethargic because all you're eating is, you can't eat high fiber, healthy vegetables. You just can't eat them, right? If this patient can come in and have those implants put in and can now eat those foods, think about that.
That's nice.
They lose weight. They feel more confident.
Do they say this is something I should have done years ago? Have you ever heard that?
Everyone does. That's what's funny about it. In fact, we had one little lady that came in and with her daughters. Were you going to say little old lady by any chance? It's a little lady.
Relative,
okay. Yeah. And she came in with her daughters. She was probably 78 or 80 years old, and she came in with her daughters. And her daughters were bringing her in, and she's like, no, I don't want to spend the money on myself. I don't want to spend the money on myself. We spend 30 minutes with her, and at the end of that, she's like, all right, girl, so I'm going to break into the pot of gold to take care of herself. And once it was done, that's the first thing out of her mouth.
What'd she say?
Why didn't I do this 20 years ago?
Is that right?
And I reassure her, I tell her it was because you couldn't 20 years ago. But what a great choice to do it today.
You loved it. Do you go home and tell your wife? I know you have 6 kids.
I do.
Right? You look so young.
6 kids.
And but do you go home and you're pumped up? Like I do. Oh, this was great today.
I tell her the great stories, That's what's fun about what I do. I'm changing people's lives for the good. And I don't take credit for that. What the credit that I take is I'm a doctor. That means I'm an educator. I am teaching people what's possible. And I'm encouraging them that they can chase their dreams. If they're willing to chase their dreams, we can make it happen.
Respectfully, though, you're a dentist. You think the smile is so important.
I do. Interesting fact.
Okay.
75% of Americans are going to judge how much money you make, how successful you are, how competent you are at your job on your smile. 75%.
Is that right?
So when you come in and you don't smile, people just discriminate. Is it fair? It's not fair. Is it real? It's very, very real.
Yeah, it looks like a moody person or something.
That's right. What's wrong with him or what's wrong with her? And you smile and you have teeth that are yucky or you have the bad breath. People just think that you're dumb or that you're not capable or that you're poor.
Okay.
All those things are wrong. Now the flip side is we feel better when we smile. There are lots of studies that show the endorphins that are released, the energy that comes out when we smile, when we just are happier people, and it spins off into every aspect of our life. People that can smile with confidence enjoy their life better. Now, they call it the golden years for these people that are seniors, that are retired. But some of them are not living up to the potential.
If you can't eat and chew and things like that.
because they don't smile, they don't chew, they're not out.
We're almost out of time, and you have some photos that are pretty dramatic. So I wanted to get to these photos.
Yeah.
It's very nice here. By the way.
This is a nice one. Rhonda is a woman that's in her mid-40s, okay, and her oldest daughter is getting ready to get married, and she has worn dentures for about 20 years. And she just decided, kind of out of the blue, why am I doing this? When she looked at the amount of money she was spending on her daughter's wedding, she realized, I have plenty of money to do something, whatever I want.
Okay.
She came in and she said, I do not want to smile at my daughter's wedding with dentures in. What can you do? So this is a case where,
boy, when you heard something like that, what, did your whole face light up?
I did, because I
Did
said,
you fall out of your chair?
Look at what I can do for you. Okay, and she went with the best possible. We've 12 mini implants on the top, 10 on the bottom.
That's like a fixed set of teeth.
Fixed sets. This is what you're seeing. That is a bridge made out of porcelain, just like any other person's crowns, cemented into her mouth.
It's pretty.
That's permanent.
It's white. I mean, it looks nice.
White. It's beautiful. It's exactly what she wants.
Because I always feel like I could spot dentures walking down the street. So you can make them look good.
Absolutely you can. Absolutely you can. And if you're seeing them walking down the street, those were not made well.
What did she say when it was all done?
She cried.
Is that right?
She said thank you. And she really felt that.
Well, what if your gums are bad?
Great question.
Because somebody said that to me. My problem is I have bad gums.
One of the great things about extractions, it solves the bad gum problem.
How?
The disease that attacks the bone is attached to the teeth. When the teeth come out,
Like the root of the tooth?
that's right. No more disease.
Okay.
So people that have lots of people lose their teeth because of periodontal disease. Hey, we take out the teeth, we take out the periodontal disease.
Gums get healthy?
Yep. Heals over, body's perfect. Great candidates for implants. Absolutely.
Interesting. So all the denture wearers need to come in,
Absolutely.
get evaluated. And how long does it take on that first, is that a free consultation?
Absolutely free consultation.
Okay.
It depends. I have lots of people that come in and they know about implants and they've read some of our literature. They've heard from different people that they're a candidate. They just come in, they write a check, and we just proceed.
They want them.
They know it. They know that they're in the right place.
If they watch this, I'm watching this,
Right?
and I want them.
That's we get that. We get other people that still need to be convinced. We get people that come in and they're kind of on the fence, and significant number of patients come in, talk to us, come back 10 minutes later or 10 days, 2 weeks later with their spouse. Now convince my spouse so I can have what I want.
Is this the happiest group of patients, you think?
It is.
I mean, when you
we
take
get to the
denture wearer-
end,
Yeah.
it is. Yeah. Or you can argue that it's the 18-year-old girl that just had her braces off. But yeah, this is it. These are the people who now have hope where before they had discouragement or despair or embarrassment. These are people that now have a chance to go out and do what it is they want to do, which is live their life on their own terms. They're not limited by what's in their mouth now, whereas before, emotionally, they felt stunted.
So if it's fixed, okay, so you get a fixed set of teeth.
Yeah.
Like this one, we got a fixed set of teeth.
Yeah.
Went from dentures, fixed set of teeth. What's the maintenance on that?
Great question. I make them come in every 6 months, just like every other patient. I look at them, we clean around them. Sometimes with fixed, improving their hygiene. Some of these people that have gone from dentures to teeth again still haven't figured out how to take care of themselves. And we need to get them on board with, even though they're not going to have any pain, they're not going to grow any cavities.
We have to be careful when we say
brush
any
it.
pain. We have to be careful when we say without any pain, so there's not disclaimers, but virtually painless?
Yeah, virtually painless.
Okay.
Great. No, that's a great point. But they need to learn again that you got to take care of it. Because a lot of patients didn't take care of their denture, and they get sore spots under their denture, and they get infections and things like that. Same thing can happen with implants if you're not brushing your mouth out.
But and we are out of time. It's great stuff. But if they're just tuning in now, you're saying that there's studies, like 10-year studies, that shows that these mini implants work just as well as far as staying in the mouth as
conventional implants. Yep.
Is that right?
At 10 years. That's exactly right. That's what's so exciting about it.
Like a few people or a bunch of people? I mean, a lot of people in the study? Like over 1,000?
9,000, I think it was. Very robust.
Because
very big
dentists
study.
will probably see this. And what do you want them to know about mini implants?
The dentist, I want them to know that, hey, doctor, go and learn about this. You will do such a service to your patients if you can learn how to do this and incorporate it into your practice. Absolutely.
And it works.
And this, because the surgeries are so simple, every general dentist out there with the courage to learn can do this for their patients.
So chewing, eating.
Exactly. Changing their life.
Well,
Absolutely.
Good for you. Thank you so much for coming on the show.
My
Excellent.
pleasure.
Excellent stuff. And if they want to go to your website, they can find out more.
Yep.
They can make an appointment.
All
They're going
from
to
our
get to
website.
see you?
Yep. Yep.
Okay. And what do they, you know what, I have to ask that. When they go in, what do they always want to know? A denture wear. What do they ask you every time?
Is it going to hurt? Biggest question. What's it going to cost? What am I going to be able to do afterward? How's it going to change my life? Those are probably the three big ones.
Do they ask what they can eat?
Yeah.
And how soon, of course, they can
What
eat?
can I eat?
Are they ever without teeth?
No, not normally. They're not. There's rare cases where they really like their denture, but it doesn't fit well, and so we'll put the implants in, send it to a laboratory to reline the inside, and then the next day they go home with it locked on. But that's uncommon.
Okay,
I don't
good.
like people going home without teeth.
All right. Thanks again. Appreciate it.
My pleasure.
Great info. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you just caught the last 10 minutes of it, you can visit our website, wellnesshour.com, and just put in Dr. David Keller. You'll find him there, or mini implants. You'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.